President.
The senator from Louisiana.
Thank you, Mr. President. Mr. President, suicide is the second leading cause of death for youth and for young adults aged 10 to 34. It's also the second leading cause of death among college students. 39%, in fact, of college students experience a significant mental health issue, and 50% of mental health issues begin by age 14. 75% of them, Mr. President, begin by age 24. Senators Cornyn, Jones, Warren, Gillibrand, Rosen, and I have introduced the Improving Mental Health Access for Students Act. There is companion legislation in the House, Mr. President, that is also bipartisan, that has 51 co-sponsors. Our legislation is pretty simple. It would require colleges that participate in federal student aid programs to share contact information for suicide prevention resources with their students. And this is how it would work, Mr. President. If a university distributes student ID cards, most do, not all do, but most do, then the universities would be directed to include the phone numbers for the National Suicide Prevention Lifeline, for the Crisis Text Line, and for a campus mental health center or program on the student ID card. If a university doesn't have a student ID card, they don't have to print a student, or rather publish a student ID card just for that purpose. They can put the information on their websites. The National Suicide Prevention Lifeline is well known, Mr. President. It's a national network of over, I think, 180 local crisis centers. Those centers provide confidential emotional support to anybody in a suicidal crisis or emotional distress. They offer 24/7 services, and those services are free. I would also point out, Mr. President, that our legislation is sponsored by the American Foundation, is also supported, I should say, by the American Foundation for Suicide Prevention, the American National Alliance on Mental Illness, the National Association of School Psychologists, and 14 other mental health-related organizations. Our legislation, Mr. President, finally, would not take effect until 1 year. So I don't want anyone to think that we're requiring our colleges to go out and immediately publish new student IDs. They would, as they publish new student IDs when the current year runs out, we're just asking them to include this information on those IDs. Toward that end, Mr. President, as if in legislative session, I ask unanimous consent that the Committee on Health be discharged from further consideration of our legislation, S. 1782, and that the Senate proceed to its immediate consideration.
The clerk will report.
S. 1782, a bill to add suicide prevention resources to school identification cards.
Is there objection to proceeding to the measure? Without objection, the Senate will proceed.
Mr. President, I ask unanimous consent that the bill be considered read a third time.
Is there objection? Without objection?
Mr. President, I know of no further debate on the bill.
Is there further debate on the bill? If not, the question is on passage of the bill. All in favor say aye.
Aye.
Those opposed, no. The ayes appeared to have it. The ayes do have it. The bill is passed.
Mr. President, I ask unanimous consent that the motion to reconsider be considered made and laid upon the table.
Without objection.